So what is something that you do, or how do you support women in that postpartum period to get hormones back on track and in those kind of healthy ranges where they feel good again and can heal properly?
Yeah, so great question. And I think it's a little bit of a catch-22 because we have some conflicting goals in the postpartum period, right? Hormones returning back to where they were pre-pregnancy is wonderful, but it's counterproductive when it comes to breastfeeding. So it really depends on mom. If goal is to breastfeed baby for whatever amount of time, we know that during that time period, those hormones are going to remain low because of the feedback mechanisms and feedback loops in the body that allow us to breastfeed. So what were once sky-high levels of estrogen during pregnancy are going to remain low during the breastfeeding period for most women because we have that feedback from another hormone called prolactin, which allows us to promote lactation for feeding baby. That kind of gives a nice insight how we work together also, because if we are going to have hormone levels remaining in an less than desirable state, we might need you to come in and help us out, right? But many of the things we do involve getting that menstrual cycle back up and running. That's a lot easier if mom is not going to breastfeed because we can allow the ovaries kind of to return to their normal function. But there's other things we can do with food and supplements that promote this estrogen-like activity in the body that potentially could help mitigate some of those things.
One of the only ways we know how to tighten or strengthen ligaments are with regenerative injections. So in most cases, PRP fits the bill for a case like this. So PRP is platelet-rich plasma. We draw the patient's blood, we spin it down in a centrifuge, and we concentrate those platelets in our blood, which are cells that are responsible for healing tissues. They're kind of the first responders to injuries. They release growth factors and signals to start a new healing response so that those damaged or loose ligaments can then start to heal, tighten. The body puts more collagen there to make them more stable. And so really the goal here with some strength training to strengthen the muscles, but also PRP injections directly into those loose and damaged ligaments can help tighten them, improve stability.